Okay, so for the next part of the assessment, I'm going to make my patient do MMTs. So first we're going to start off with the glute med. So as you see here, we have the bottom leg, the bottom knee flexed as support. So my patient's going to have their hip abducted and slightly externally rotated. We're just going to try applying pressure downward as they resist, so go ahead. Perfect, so 5 on 5 strength on the unaffected right side. So we'll also do glute med MMT. So it's going to be the same thing except the hip is slightly extended. So bring your leg up and push up. Perfect, that's 5 on 5 strength for that. Next, I'm gonna have them turn side so that we can work on the affected leg. So again, the bottom leg is going to be flexed. We're going to do the glute med test. So hip slightly externally rotated. Just bring your leg up a bit more. And go against my hand resistance. Okay, so that's about a 4. So now we're going to do the glute med. So it's the same thing, bring your leg up and slightly extend the hip. Perfect, like that. So bring your hand, actually, and if you don't mind just going up forward a bit, just bring yourself forward. Bring yourself forward that way. Forward, forward. Perfect. Okay, so again, bring your leg up, slightly extend it, and we're gonna test for the glute med. So go resist against my hand. So we're gonna give that a 4. Next, we're gonna be doing hamstrings. So if you could just stay on your stomach. So now we're going to start with the right unaffected leg, testing the medial hamstrings. So we're going to have them rotating their thigh and their foot internally. So just bring the foot in like that. And you're going to flexing the knee about 70 degrees. And now I'm going to tell them to push towards my hand and towards their buttocks. That's a 5 on 5 strength. Now I'm going to test the lateral hamstrings of the bicep femoris. So rotating the leg towards me and also the foot. And you're going to bring again your leg towards my hand. 1, 2, 3, 4, 5. 5 on 5 strength. So now we're going to do the affected left leg. So bring your leg up, the leg and the foot towards the inside. Test the medial hamstrings. I'm going to push towards my hand. Go ahead. 5 on 5 strength. Now laterally, so towards the outside. Pushing against my hand again. 1, 2, 3, 4, 5. So that was a big week there. So we're in it, I'd say about a 4+ on 5. Okay, so for this part of the assessment, I'm gonna have my patient do some flexibility testing, starting with some ELIs to see the flexibility of the quads, especially the rec fem. So I'm gonna have him bring both his legs towards the buttocks. And seeing here, it seems like the right unaffected leg is able to get a little closer, but not a significant difference. So next, I'm going to have my patient lay on their back. And I'm going to have them do Faber, so I'm just going to ask them to come out a little. Extend the legs. and just go back towards the wall, towards there. Perfect. So yeah, you're gonna start out like this, with the legs crossed. Opposite I'm gonna have the other hand on the opposite ASIS to stabilize, and this is just so we can check the flexibility of the adductors. So it stops at this position here. So I'm going to compare with the other leg. So again, hands on the opposite ASIS, bring it down. And this side actually seems to be a little more flexible, the right unaffected side. So next I'm going to have my patient. We're going to check the flexibility of the hamstrings. So we'll start with the right unaffected leg. So just bring this leg down. How's that? Good. Now I'm going to bring the other leg up to compare bilaterally. Keep the leg straight. Are you able to straighten out your knees? Okay, perfect. Tell me when to stop.
On the left side is a bit worse than the right.
You feel more tension on the left?
Yeah.
Okay. So while I have my patient in this position, I am also going to do the straight leg raise test. Since one of my indices was sciatica. So we'll start with the right unaffected leg. So I'm going to bring him up till he feels a bit of tension or neurological symptoms. Yeah, okay. So bring it down a little. I'm going to bring the foot into dorsiflexion. Is anything felt?
Just a bit of stretch.
Okay, so it's just a bit of a stretch. You don't feel any numbness, tingling, or burning? Okay. Perfect. We're gonna now try on the left affected leg. Okay. So just a stretch. Okay. Bring it into dorsiflexion, the foot. What do you feel?
Yeah, I feel like it should.
Sorry?
I felt something like it should. Just a little bit.
What did you feel?
Like pain. Like,
Okay, so you felt a radiating pain? Okay, so we do have, so on this side it does show some neurological symptoms on the left affected leg. So this could perhaps confirm my initial indices of sciatica. Of course, I will be doing another test after, but this is one indicator. Okay, so now we're going to be checking the flexibility of the rotators. So first starting off with the external rotators. So I'm going to ask my patient to lift their legs up. And I'm going to ask them to open them up to go into internal rotation. So that way we could check the flexibility of the external rotators. And the left one seems to be less mobile compared to the right. Now I'm going to ask my patient to drop one leg. I'm going to check the flexibility of the internal rotators by going into external rotation, so go towards the inside. Perfect. Now I'll do the same thing with the other leg. Perfect, thank you. Okay, so now this part of the assessment, I'm going to have my patient do a couple of special tests. So we're going to start with slump. So we'll start with the right unaffected leg. So I'm going to possibly bring my patient's neck into flexion, possibly extend the leg. They ask if they are feeling any symptoms or any kind of tension or pain. No? Perfect. Now bring it into dorsiflexion. How's that?
it's good.
That's fine. Perfect. Now have them go just on the affected left side. So again, bring it to neck flexion. Extend the leg. then dorsiflexing the foot. And they are starting to feel pain and tension, so that would tell us that they have no meningeal tract tension. Next, we're going to do the piriformis test. So I'm going to have them lay so that we test the unaffected side first. Okay, so just come more towards me. Perfect, so I can keep the bottom leg straight. Top leg is going to be flexed about with the hip flex at around 60 degrees. Applying one hand at the hips just to stabilize the pelvis. I'm going to apply a downward pressure and see what kind of, if they feel anything. Do you feel anything, any tightness or any particular symptoms?
Just a stretch.
Just a stretch, perfect. Now I'm going to ask my patient to flip over. We're going to do it on the other side. So again, hip flexed, hands on the pelvis to stabilize, downward pressure. And what do you feel?
Yeah, I felt a bit of like pain right here.
Okay, so it's at the thigh though?
Yeah. Sorry?
It's at the thigh?
Yeah.
The symptoms?
Yeah.
Okay, but not in the gluteal area?
Yeah, it's around here. Like, and it just travels a bit.
Okay, perfect. Okay, so in this part of the video, the assessment, I'll be doing specific palpation to finish off. So first going to start off with the glutes. So checking the glute max on the unaffected side, that's fine. On the affected side, seems a bit more tender. Even when checking the glute med, seems a bit tender compared to the right side. Also going to check the hamstrings. Those seem a bit tight, but that seems to be the case on both sides. Going to check the sacrotuberous ligament, so from the ischial tuberosity to the sacrum. This seems okay. When palpating this one, it's on the left affected side, seems a bit tighter. Also going to check the lats, which seem okay. Alright, do you mind just going down a bit? Just relaxing? Perfect. Seems okay. Palpating the QL from the last rib all the way to the pelvis, that seems okay. Just checking the ischial tuberosities quickly. Those seem even, I don't see any abnormalities in that either. And that's about it. Okay, so finally from my clinical impression, I do believe that based on all the assessment and all the tests that were done, it does back up my first indices of the patient having sciatica, especially since they do complain of radicular symptoms, especially burning from the gluteal to the mid-hamstring area. Also the slump test and straight leg raise test was positive. That also backing up my first indices. However, it's not to say that the third indices isn't to be considered, which was piriformis syndrome, since the piriformis test was positive, and there was the external rotators were tight, which includes the piriformis, so that could be placing pressure on the sciatic nerve. For the glute tendinopathy, that too, it's not to be ruled out completely, especially since there's a lot of muscle imbalances in the area. However, I do feel that that's not the main thing that's contributing to the pain, especially since there wasn't really a Trendelenburg stance noticed in the functional movements.